Every single patient is an individual. You can't put a mold around a person, expect them to do the same thing and have the same outcome. So that individual is a big picture. Often, from our point of view, we get one piece of that picture. By talking to more people and bringing everyone along on the team, we can each share our piece of that big picture, put the puzzle together, understand the story, and help the patient.
The HealthLinks program is an opportunity for a patient, instead of having 10 care plans with 10 different agencies, or perhaps no care plans with any of these agencies, getting all the professionals and supporters in one room together with that person to work on a plan that makes sense for that person to help them achieve their health goals and their social goals and their community goals.
It is an opportunity for you to share with us some challenges that you may be having in the home, or some goals that you would like to see achieved. What would you like to do in the next couple of weeks or months that you have not been able to do? And you may be worried about it, you may be stressed about it, or it might just be a heart's desire of yours. And then having you tell me what that means, and then I help you understand that we as a team, who you choose to have as your team, you get to choose anybody, can be participating in that. We're going to help you achieve that goal to the best of your ability and ours, and we're going to continue to work with you and support you so that you feel that you've had an opportunity to experience the best that you can with your health, with your personal life, whatever that may be. It's an opportunity for you to participate, that we can support you and come to you and be a part of that with you if you're interested.
A lot of times we just focus on the patient, but one thing I find with this program is that we also bring the caregiver into the dialogue as well, because they're very much involved in the healing process of that patient.
Who are your main supports? That can be family, that can be neighbors, that can be friends, or that might just be your healthcare team, your doctor, community care coordinator, it might be your pharmacist. You get a copy of the document, we write it out for everybody, it gets shared with your team, and then we follow up in a couple of weeks to see how's it going. Has there been any achievement? Is it in the process? Do we need to revisit it? Do we need to look at adding or changing your goals and looking at that? Moving forward, we check in, make sure that you've achieved the goals, and if there's new goals at any time, we revisit that for sure.
When I was asked to join, I really didn't think that they could meet my needs. I just thought, you know what, you're wasting your time and my time. Get me in the nursing home. After I had this care conference, I knew that everybody was on the same page, and that was so reassuring. The meeting is key, and what I like is that the CCAC supervisor would have that meeting as often as we needed it. Mostly it's just she and my daughter and I, and sometimes just she and I. But any time that it needs to be everybody, she's willing to do it. You can really feel free to say what you feel like, you know, and why you, if you're feeling reluctant to try, perhaps if you shared why you were reluctant to try, somebody there might get it, what your issue is, and they could say, I know exactly how you feel, and this is what I would suggest, you know.
It's actually very empowering to the patient to know that they can get that care that they want and not just have it kind of dictated to them.
You know, having the coordinated care plan, you will know who the best person is to call when you become ill.
It was a huge relief. Huge relief. I can't tell you how much. I'm not anxious at all at home now, and I was always anxious before.
The healthcare system can do better for people, and sometimes we just don't know where to start. And I think the HealthLink allows an opportunity without thinking too hard about where you should go. Go there and see what happens, and try to focus on that client and that caregiver and what's really important to them. And all kinds of interesting things are going to happen, and interesting positive results.
The main gentleman I've been involved with used to be in hospital probably 3 out of 4 weeks in a month, and I'm happy to say that in the last year, with some more early interventions, he spent a whole lot less time in hospital and has been able to get much better support at home and live his life there rather than an institution.
I was impressed at how good it was. Like, the results were so good. It made such a difference. I went from being miserable to being happy. It was great.